So, good morning, viewers. And today is World Red Cross Day, and Red Crescent Day. It is an annual celebration of the principles of the International Red Cross and Red Crescent movement. World Red Cross Day, Crescent Day, is celebrated on 8th May each year. This date is the anniversary of the birth of Henry Dunant, who was born on 8th May 1828. He was the founder of International Committee of the Red Cross and the recipient of the first Nobel Peace Prize. The motive of celebrating the Red Cross Day is to reduce and terminate the suffering situation among people and raise their dignity to the next level. So I'm Dr. Rakesh Gupta. I'm President and Director of Public Health Strategic Institute for Public Health Education and Research, and I'm former Director of Health Services and Director of Chemical Examiner Lab Punjab. I have with me Dr. Sonu Goyal. He is Professor in Department of Community Medicine and School of Public Health, PGI Chandigarh. And he is also Program Director for International Public Health Management Development Program, sponsored by Ministry of External Affairs, Government of India. So dear viewers, we welcome you all to this very special edition of Cypher Health News channel, coinciding with the World Red Cross Day on 8th May 2021. And it is my proud privilege to introduce Padma Shri Dr. Amod Gupta. So Dr. Amod Gupta, he is Emeritus Professor, Postgraduate Institute of Medical Education and Research, Chandigarh, India. He did his MS Ophthalmology in 1976. He was Dean Medical Faculty, PGI Chandigarh from 2011 to 2014 and was Professor of Ophthalmology, PGI Chandigarh, 1993 to 2015. And he remained head of the Department of Ophthalmology from 1989 to 2015. He raised one of the most advanced eye care centers of India, the Advanced Eye Center at the PGI in 2006. He has been at the forefront of clinical research in the field of retinal and the uveal diseases, and has published 395 original research papers in peer-reviewed journals. With more than 7,900 citations in the Scopus database, he is one of the most cited ophthalmologists from India. And he is also founder president of the Uveitis Society of India and also the ex-president of Vitreo-retinal Society of India.
So Dr. Amod Gupta has various awards to his credits, more than 40 awards. He won the coveted Padma Shri award this is the fourth highest national award of India in 2014 by Honorable President of India. He was a founder president of Uveitis Society of India in 2004 and was installed by Professor NA Rao, one of the leading international experts from USA. He received many awards, won Sisley Award, Medal Award of German Ophthalmological Society Berlin in 2015, also received the Vitreo-retinal Award by Punjab University in 2015. He was also recognized as by American Academy of Ophthalmology as Unsung Hero of Ophthalmology Year of the Eye 2020. And beside this, there are n number of awards which Professor Amod Gupta has won.
So he has, as I told you, he has published many research papers, about 395. In 2003, described a new entity, tubercular serpiginous like choroiditis, that is recognized all over the world. Then he also published fungal endophthalmitis following cataract surgery, clinical presentation, microbiological spectrum and outcome. And then he also got published fungal endophthalmitis, 14 years experience from a center in India, and the classification of intraocular tuberculosis. So these are all. So Dr. Amod Gupta sir, we welcome you. And we will like to know about your family and some glimpses about your personal life, your mentors.
Well, thank you so much, Dr. Rakesh Gupta and Dr. Sonu Goyal, for giving me this opportunity to share some of my personal thoughts during this informal interaction with you. I must congratulate you on this great initiative taken by you for the benefit of all of us in the community. I come from a very middle class family and was born in the newly minted Republic of India. My father was rather a junior civil engineer in the irrigation department of Punjab. And he was often posted in the field duty. Due to his transferable jobs, he never stayed in one place for more than 3 to 4 years. So kind of never established any deep roots in any place. I had never seen in my life father sitting at home. Okay. He was practically at work the whole day, even when he was not in the field. And I still remember very distinctly, we used to take uh, kind of midnight rides with him in his Jeep when he would go inspecting in the field, in the rural areas, inspecting the works, because that is the time when he could actually go and inspect those works. No, he often didn't know what class I was studying. He didn't have time to know that, but he was a proud father. And whenever the results came, he would proudly kind of showcase me to all his acquaintances with a cup of tea and sweets. And this happened year after year as I taught the class. Of course, I was a student in Hindi medium school and in small towns and cities of North India. Now, this positive feedback from my father and my mother gave me enormous self-confidence. So coming from that kind of a background, studying in small Hindi medium schools was never a handicap. On the other hand, it gave me so much overconfidence that I could face any situation in my life. So much so that even as a 10-year-old, I knew that I'm going to become a doctor. And there are no questions about it. More importantly, the fear of failure was never discussed. And because of that positive attitude of my father and my parents, I have never entertained a negative, thought all my life till date. So I'm sure my friends and colleagues recognize me for a positive sort of mindset. That is the genesis of my mindset. Never entertain a person with a negative thought. And I strongly believe that the values we imbibe during our early years, either at school or in the house, home, they stay with us forever. Now, these are the values which my father didn't have to tell, be confident, do well. No, work hard. He was working hard himself. He didn't have to tell me that you have to work hard.
Yeah, right.
Okay. So if you, and I mentioned the Republic of India, the newly minted republic. And this was the generation, my father belonged to a generation who had spent their youth serving the British Raj. And now the India was a free country. And these guys were doing nation building at their own individual level and hardly ever cared for their personal needs. The example I gave you, he would go to midnight rounds for inspecting the field, whether the work got done appropriately or not. And thanks to my parents for inculcating this capacity to work hard and completely tenacious and complete honesty and integrity. I never went to bed without solving a clinical problem that came to my attention. I had to solve it before I went to sleep. I'll just give you a small anecdote about an example of humility in achievement. We were celebrating, or gathered together as a family to celebrate his 100th birthday. Okay. And we were just sifting through his old papers that had been lying boxed up for ages. He had been gone for almost 30 years. And what I chanced upon was the Samman Patras, old, frail, Samman Patras, which he had received way back when, 1939. At the age of 23 years, he had been honored by the then government of Punjab while he was working on an irrigation project called the Haveli project. And once again in 1953, for meritorious work in building of the Nangal Hydel Channel and the Bhagra Nangal Canal. Now, can you imagine? And not only him, I think his father, who worked on the Nangal Dam all his life, he was awarded with the silver pocket watch. And I think that watch was perhaps deliberately shown to us from time to time to set a benchmark. Then we have to carry forward the legacy of our father and grandparents. He had never discussed with any one of us these manpatras. Never, all his life. He never mentioned the achievement. And this was a lesson in humility I had to learn much later in life. I had even after I retired. So I think in short, values you inculcate in your children, the values you inculcate as teachers in your students. I believe both parents and teachers have a far greater role than teaching and parenting. They are like actors on stage in theater, performing all the time for the benefit of their children and students. They cannot go wrong. There are no retakes in life. If you're not working hard, if you're not honest, don't expect your children or students to be honest and hardworking. They might. If you smoke, if you drink publicly in front of them, they will follow suit.
So thank you, sir. Thanks for sharing the glimpses of your personal life. And that is the reason we made it an informal talk, because we wanted to know about your actually personal life, your parents. And I have been observing you as a young ophthalmologist from 1989.
Oh.
So I don't think you'll remember that, because my thesis went to you.
Oh, really? Wow. This is interesting.
And sir, the sanskars given by your parents, they show in your work and your conduct, sir. So I'm really impressed, sir. And you had great mentors like Dr. I.S. Jain and maybe others also. And you have shared some photographs also.
Yeah.
So thank you, sir. So Dr. Sonu.
Yes, sir. It was really a privilege listening to you, and I think in PGI, when I joined as a young faculty member, so I still remember I had very few interactions with you, and I used to see as a towering face, but at the same point of time, when I used to meet you, so you are very humble and you are very ground to earth. Right. So, sir, just want to know, besides like being an honest and hard worker, since your early part of the life, which has been inculcated by your parents and by the situations you have been in. Sir, just want to know about your journey as an ophthalmologist of international repute, because people know you not only by your virtues or your values, but also as a very internationally renowned ophthalmologist.
If you allow me, Dr. Sonu Goyal, I would like to go back because, as I often say, that you are born, but just a bundle of genes. You're born with a clean slate. What you become is the interaction of those genes with the environment, with the people, the experiences you go through interacting with all the people who come across, and in our case, the patients, the teachers, and how you are brought up.
Right.
So, I'll go back a little this story, if you permit me.
Yes, sir. Please.
I got a place in the merit list in my matriculation examination. And those were the days, very simple days. I got invited, in fact, by letters coming from all the leading colleges of North India. And they were offering free education. They were offering free books. And if I was an outstation student, they were offering a free hostel. You'll be surprised to know that I never paid for any tuition fee, either in the college or in medical college, just because of my performance in the matriculation exam, which fetched me a national scholarship. Now, we chose to move to Chandigarh and chose DAV College, Sector 10 in Chandigarh.
Yeah.
And one of the reasons was over other colleges like Hindu College, Sonipat, or DAV College, Amritsar, or DAV College, London, where I had the similar kind of offers, was my father, during the last 10 years of his postings or his career, he got posted in Vyasatruj Link project, which was spread over Sundarnagar, Mandi, and Pandau. So he spent 10 years there, living all alone. And our family shifted to Chandigarh. Now, here, Principal Trilokinath, I'm not sure your listeners would remember him. Okay. He reinforced that positive feedback, the confidence. Practically on a daily basis, he would meet me and some of my fellow friends. There was never a doubt created in our mind that whether we'll get admission in a medical school. The question uppermost which Trilokinath used to pose to us was, who among you is going to top the university? Remember, those are days when there was Punjab University all over North India. I think the current generation, the problem with the current generation of students, there is, on a daily basis, they face an unending barrage of what if you fail to get, what if you fail to get into a medical school, what if you fail to get into an IIT.
Right.
A constant vicious cycle of negative feedback, the fear of failure. That is what is leading young students to commit suicide, go into depression, and face all the mental sickness that we see around. Sure enough, out of this current system, some would thrive and come out winner, but not all. Now, when I joined medical college, Rohtak, my days were rather unremarkable. Nothing except that the first 2 years of life, I somehow happened to suffer from a very protected chronic sickness, which left me deprived of any physical energy. Yet I managed to pass each of the professional exam, of course, never topping the class ever achieved. Now, what I recall, when I look back, teachers were good, outstanding. It was a very new medical college, and the faculty had come from Amritsar and Patiala. We had very towering personalities, surgeons, physicians, led by Dr. Indrajit Diwan, who was the professor of anatomy and the principal of the college. But the teaching methodology was rather obsolete. When I look back, how come they were never encouraging us to go to library? Never open a book outside the course curriculum? I still distinctly remember the impact it had on our mind and the kind of excitement in the class when one of the surgeons, I think Dr. Keshwani was professor of surgery, he brought an epidiascope to project a very complex anatomical diagram to show us from a book. Oh my God, we were so excited. I remember even now, 50 years later, the first exposure of semblance of a technology. Otherwise, what were they doing? They were just dictating notes to us. We would note them down in the copies. I don't know how they teach them now, but those were the days. But at the same time, I'll tell you, and that was during my internship. It was an elective internship, and I chose to work in psychiatry. And Dr. Vidyasagar was the famous psychiatrist. I'm sure everybody in India has heard of him. He was truly an epitome of hard work, diligence, simplicity. Awe-inspired, I would sit in his clinic, guess it, from 10 a.m. onwards, after he had finished his ward rounds, till he saw the last patient, which was very often past midnight without a break. And of course, he had completely captured my mind space. I desperately wanted to be one like him. Okay. And I opted, when the opportunity came, I opted for a house job under him in psychiatry. Now, the question Dr. Sonogoyal asked me, it's again was a lesson, because how I was going to become a psychiatrist, and I became an ophthalmologist. So I really don't know whether it has been the loss of psychiatry or been a gain for the ophthalmology. But, you know, as they say, serendipity played a major role in my becoming an ophthalmologist. I had been selected as a first-year resident in ophthalmology as well in PGI. But I had rejected it and outright in my mind that I'm going to go back. I was to leave for Rohtak. I had come for a short while to say bye to my parents. Said, well, I'm going to join Rohtak, the secretary department. What happens? Next day morning, I have to catch a bus to go to Rohtak. And suddenly, during somewhere in the middle of night, I overhear my father telling my mom how he had such high hopes from me that I would become an ophthalmologist. And he has demolished my decision, by my decision. Mind you, we had never discussed ever what I was going to do in my life, how I was doing in classes. Never. But secretly, he had prayed to God. He prayed very hard, it seems, and built all his hopes on my becoming an ophthalmologist. There was no question of my betraying his trust.
Right, right.
And so I came and joined on 1st of January 1974. The Department of Ophthalmology, then a single hallway you might have seen on second floor, D block.
Yeah.
Used to be a single hallway department. And my first encounter with Professor Jain. He said, where is your torch and loop? And I fumbled for a response. I didn't know what to say. And he said, remember, this is PGI. This is not Rohtak. I think I would need to remember this sentence forever in my life, that we have to live up to the expectations of working in PGI. It puts you on a different pedestal. Okay, now you are not anybody. You are somebody who is going to bring about change. You know, there was so much I had to learn from him. You know, like he was punctual. You could set your watch by the time he moved or came to the department. There was no question. He had very sharp observation skills. I think at that time I believed, and I think very rightly so, he was the sharpest clinician that we had in India among ophthalmologists. He had been, of course, trained in UK for his efforts years in DO, and he carried that legacy of UK training, very comprehensive, interest in all subjects of medicine, not alone ophthalmology, very hardworking. Above all, he was obsessed with documentation and photography, obsessed to the extent of being fetish about this. Something I learned the hard way from him. I'm not sure if many people remember or recall, we used to have a department of photography in the first floor, ground floor, A block. And I used to visit that department, that photography department, and Panditji and Mr. Seko and Mr. Kohli every day of my life. Taking a patient along, getting him photographed, he would keep accumulating those pictures. They were very, very primitive from the current standards, very primitive. We couldn't decipher anything. But, the obsession he created in me for documenting every patient, every photograph possible, I think took me to reach the international space which you speak of, because nobody in India was doing it. Nobody was doing it even in the best of the institutes, in private or in the government sector. Nobody was doing it. He made me believe that we are no less than other physicians. And that is how he generated my interest, apart from ophthalmology, looking around, the patients in medicine, looking around patients in neurology and neurosurgical wards, in gynecology, and everywhere, and that is how, something I worked later in life, was depending on how I had that particular interest in the ophthalmology, how it was interacting. He was intolerant of mediocrity. The old alumni, they used to make fun of me. How come you have lasted 15 years with me? We couldn't last even a year. He used to lose his cool if anybody made even a tiny mistake. He was perfectionist. Simple surgeries he would do, but they were perfect. No step repeated again. And they lasted. Not only lasted, I became his colleague from a student, and then also succeeded his chair when the time came. I think if I could do or contribute some original work later in my life, I think thanks are due to Professor Jan for inculcating in that spirit of documentation photography. He used to say that, well, I have a sixth sense, this patient is going to come back. Actually, he would write letters to them to get them back in the clinic. And just to tease us, he would say, I have a feeling this patient is going to come today. And lo and behold, the patient was there. So the follow-up of the patients, a virtue which existed in its being absence all over the country, I think I could capitalize on that virtue. That you need to see the patient, even if he gets well, you need to see him again and again, again and again, again and again, all his life. And you won't believe it. My follow-up records has been over 95%. All my patients came back when nobody in this country liked to see the patient back again for a second visit, not knowing that the patient was faring well, better, or had gone worse. They always had that fear because they had never known, that facility. Now, I was given charge by Professor Wahi, despite all the contrary opinions that he received from faculty colleagues in the PGI. He kind of trusted me with the department, making me the chair. And I had to take very hard decisions. Fortunately for me, 1987, I had a very brief opportunity to go to US in a very leading eye institute, and that would change my life forever. And I'm a great believer that this exposure is very important. You must see what the rest of the world is doing. It ought to be very short exposure. If you stay too long, you either don't want to come or you become critical of the Indian way of doing things or Indian systems or Indian patients or the Indian hospital. You will keep criticizing till the end of your life, doing nothing to improve, the settings. This literally opened my eyes to the world of possibilities. This was an institute where I saw them performing complex surgery and very complex microscope that I'd never seen. I thought, well, if we are given an opportunity, well, I could also do the same surgeries. Okay, there's nothing, not a big deal. I saw, which was again left me, there always a balance between the doctors and the patients. We always thought we are gods because the patient thought we were gods, providing them care. We were doing some kind of a favor to the patient by writing a prescription, by treating them, by operating them. Now, here I came across a bunch of people, very celebrated authors, somehow all in one institute. We used to read their books, but when I saw firsthand how they would interact, how they were humble, how they were apologetic for a little bit of nuisance or a pain that treatment was causing to them, I said, what's going on? I learned the lesson. We exist because of the patients, not vice versa. But these are the guys who would queue up behind, their residents or fellows or anybody ahead of them in the line to go up or down the elevator. When I came back, I was shocked. People would push me around and get into the elevator as soon as the cage landed. I had never known that something like a line, what they call the queue as the line. And something again that went to building the institute was, what I saw was that the institute had been divided into several subspecialties and each worked alone. So when the opportunity arose, I invited all my faculty colleagues to my room and asked them to choose a subspecialty. Remember, by now, almost 1/3 or more than 1/3 of my working life had gone by, and I had been operating and doing things like a comprehensive ophthalmologist. I did practically all variety of surgeries, but there and then I had taken a decision, well, I'm going to focus only on the diseases of the retina and uvea. Come on, what you choose for yourself. So we sent Professor Jagatram for cataract surgery, Professor Seni was there with us for cornea, and so on and so forth. Everybody agreed, well, if we want to make a name for ourselves, we have to focus, concentrate our energies in a very narrow area. And I'm sure, Rakesh, you will know that Dr. Jagatram used to do retinal surgery, and I used to do cataract surgery. I used to do oculoplastic surgery. Now you ask Dr. Jagatram, yeah, we should do retinal surgery. I mean, everybody, Dr. Seni, as a cornea expert trained, used to do laser for diabetic retinopathy because everybody wanted to do everything. And that had somehow come from the legacy of UK training of my chief, because they were all comprehensive, whereas the American way of doing things was in a very narrow focused area. Now, another lesson, I learned and I practiced. If I said and shouted from the rooftop that I'm working very hard, I'm working very sincerely, even within the limitations of our equipment technology, I work long hours. I am a very honest person. People will say that fellow is gone crazy. But if your patients who actually experience your expertise, your behavior, your communication skills, go and tell others, people would believe that. So it's the patients who are our goodwill ambassadors. They create an aura around you and around the place. The PGI is now has trust of millions and millions of patients, not because of what we say from the rooftop that PGI is a very big institute, we are doing such a great favor to you, but the people who come, avail of these services, and go and tell their neighbors, go and tell their relations. So the word spreads, the aura, as I call it. Now, this was a very big message I realized because people heard, Dr. Walia was the director then, he heard from not from me, but from his social circle. You people are doing great work with all the limitations. What can I do? And if you remember the early 90s, India was facing a great economic turndown. Importing equipment, procuring equipment was a big hassle. And then suddenly the economy opened up. Walia had a major vision for the institute. He was instrumental in giving birth to the advanced pediatric center that we see now. And he always felt that I have to do something for ophthalmology. And he told me, look, Lions International, I know some guys there. Why don't you write a project? Why don't you, we'll try to get you a nice center. I wrote a project, a very nice detailed project, a blueprint for future advanced eye center. And I submitted to Lions International. They said, well, we are supporting only cataract surgery. I said, I don't need cataract surgery. We're doing that very well without your support. But we need an eye center in North India. They said, no, we have no funding. So, well, Dr. B.K. Sharma came along. All of a sudden, one nice evening, he calls me and says, Amod, can you give me a blueprint for advanced eye center? I've just got 1 or 2 days. And I said, sure, I have it ready. When fortunes smile on you, you don't know when they're going to smile on you. You have to be ready with your all the data, with all your preparation, with your blueprint. And that is what I submitted. People had heard, imagine to my amazement, people who were managing the planning commission at that time had heard about good work. And they all said in one voice, we need to support. Let's have an advanced eye center. And we never looked back. That is how the advanced eye center came up. The money was not enough. We had to take a call in the faculty. What do we do? We wait for the building? Do we wait for the manpower? That is what is all about the centers. And we decided, no, we are going for the high technology. And some of the technology we put in our money that was available, we pioneered that technology in India, actually. And that put us on a much higher pedestal. The building came along, but then also, it was sufficient just for the structure. But then came Dr. K.K. Talwar. He had heard about us, in Delhi. And he says, oh my God, I'm going to make sure you guys get whatever you need. So whatever we have today is courtesy. Professor Talwar, who made it a mission to make it and it was one of the very great proud moments for us when then President of India, Honorable Abdul Kalamji, he expressed his desire sitting in Rashtrapati Bhavan. He says, well, I've heard you have some very nice centers. I would like to visit one. And Dr. Talwar said, well, why not you visit our advanced eye center? And this is, and once he came after the PGI convocation, he wouldn't leave it. And his staff would be nudging him from the corners, would be eyeing. This guy has to leave for Delhi because it's getting late in the evening. His flight will not take off if we get late. And he was totally involved, totally immersed. It was a great moral booster for us to keep doing well.
Right.
We had planned that center for just 500 patients just before the COVID pandemic. You know how many came? 2,500 to 3,000 patients a day.
That's right.
A big chunk of the PGI outpatient population came to avail our services. The
Right.
papers that we wrote in 10 years, last year they published as many, almost 150 papers in 1 year.
That is great.
Right.
We used to, it took me almost 20 years to get a podium to talk about our experiences, talk about the documented cases. But when I got that, there was no looking back. Courtesy Eye Center, and before that, our work, we got opportunities to go around the world, talk to people. Now a situation has come where the international experts would want to visit the Eye Center. They want to come and learn. The guys who used to come and tell us, okay, we are going to teach you. Now they are the guys coming back, want to learn from our experiences in the Eye Center. So that is the stage we have reached. But if I say the credit goes to me, no. The credit goes to all my colleagues, all those whom I interacted, and all those who trusted in our wisdom and in our.
Mhm. Wonderful, sir. I think wonderful listening to you. We were really as mesmerized just by the discussion which you are having, and still now, because I am in PGI, still now Advanced Eye Center is not only being recognized as a center of excellence in eye healthcare, but also emulized as a center which other centers must emulate. So
Yes.
basically, in terms of not only eye care, but also in other healthcare setup like advanced heart care centers and advanced centers, and also the virtues which is still there in those centers, the virtues of hard work, virtues of professionalism, not seeing the mediocrity, because every person there is now a top shot in eye care.
The top, yeah. I'm
Yeah.
very proud of all of my faculty, and a large majority of them now are international celebrities on their own.
Right.
There is
Right.
not a
Right.
single meeting where
Right.
you would be not seeing these guys.
Right. And because of the virtues which you have told, I think the n number of virtues I start writing and then I stopped it, because there are lots and lots of virtues.
These
You
are
took
small
hard decision.
day-to-day lessons you learn, you know.
Sure, sir. Because the young professionals who are be listening this talk, I think they should know what is the importance of taking decisions, even hard decisions sometimes. What is the importance of being professional? What is the importance of being living up to the expectation of an institute of eminence and not living to the mediocrity? Using every opportunity and having a vision, a long-term vision, distant vision, and you should not only be a expert but also be humble towards the patient, also having the open mind and focus on certain areas which you are expert at. So these are some of the things which I penned down from the talk, sir. It was really
Thank you. I think I would take it as a credit to me that I could make so many points. I'm just speaking out my heart, you know, and sharing some of those things. They would
no,
make
it was
an
wonderful,
impact.
sir. I think it was wonderful talking to this thing, Dr. Rakesh.
So, sir, if you remember, we were having some CMAs
Yeah.
in collaboration with PGI. I think that was maybe 2016.
Yes.
Yeah, Madam Vinny Mahajan, she
Yeah.
asked us to get those CMAs initiated for benefit of our ophthalmologists. And those days, I think you were about to retire, or I think you
I
retired.
had just retired.
And I asked you one thing, that you are now at the top of, uh, in your career. So why don't you continue operating? Then you said that because the infrastructure I have created, I won't get anywhere else. So that is the reason you decided not to practice privately. So that was excellent, sir.
Dr. Rakesh, if I tell you that that has been the failing of most of the people. Because of fear of competing with their students, the teachers would not share their knowledge. They would not allow students to pick up fine nuances of surgical skills, and they would be tight-fisted. So I had to take that hard call. 1989 itself, when I took the decision, I decided in my mind, my family endorsed that I am never going to practice. So the decisions that I would take would be with a clear conscience, without any my personal hidden agenda. That once I retire, I should be able to do a particular surgery and not my students. So no way. So this is like that Sonovel was talking about some of the carry home messages. I think the biggest was you have to take a decision. Are you going to compete with your students? Or you are allowing them to grow on their own?
Right.
Let them leave them a free field to grow.
Right. Right.
So actually, we had many things in our mind, and because we have some limitation of time.
Yeah,
So,
yeah.
sir, I'll just ask you about your message to our young clinicians and public health specialists. So we'll be participating in the PGI, the International Public Health Management Development courses, and our public health specialists are already, in the specialization. So what will be your message to them, sir?
My message, let's say for the public health specialists, I'll come to that.
Okay.
I strongly believe that health of a nation is reflected by health of its public health. No matter how many institutes and super specialty hospitals you create, the nation will remain sick unless you pay attention to its public health. In its myriad dimensions, public health would bring about that change in the health of the nation. But public health specialists have to demonstrate and generate empirical evidence how their intervention can bring about a sustainable change in the health of the nation and community. If I give you an example, is the current pandemic. What I find, we have to convey a very simple message: wear a mask, maintain a COVID appropriate behavior. We keep crying from the rooftop. People don't adhere to any of the norms. They don't follow the dictate. Why don't they don't do? Because we have never tested the efficacy of our communication skills. We have never ran experiments that if we use this particular strategy, is it going to be more effective, less effective, or not at all effective? What impacts the community? What can bring about a change in the behavior of the community? I think that's a major intervention, the empirical evidence. Who will create? I will not create. As an academic physician, I can only, through my own work, I can bring about efficacy of a particular treatment. Which for public health, we don't need those sophisticated instrumentation or equipment or technology. No amount of drugs or surgeries or bypass or, angiographies can replace a message of healthy food, healthy habits, healthy lifestyle, controlling diabetes or hypertension. But we have failed to. We know what is effective, but the community doesn't realize. Why? Have we tested? So we don't know how to fill that gap, how to be effective communicator. I think this is my brief message because I don't know whether Dr. Sonu Goyal will agree with me. Communication is a key to public health.
Right, sir. Right. I totally agree, sir. Totally agree that. Right.
Now, for the specialists, I think again, I have a very small piece of advice, and that is to constantly learn from experience. Document your cases. Document whatever, wherever you are. Be you are sitting in a primary health center, in a civil hospital, in an institute, in a medical school, wherever. Please document your cases. Don't bury your problems under the carpet. Your problem cases should not allow you to sleep. That's a principle I followed all my life. And given the means and the width and breadth of the internet, which was never available to us in our growing years, there's no reason why the health departments cannot provide for a subscription to a broadband connection to all the doctors sitting in primary health centers, teach them how to access the valid and relevant websites, relevant literature,
Right.
to fill those gaps, and if they lack somewhere in their skills, our
Right.
priority should be fill those gaps in training them, providing them the skills. Okay, now times they are changing. This is not my saying, this is Bob Dylan, who got Nobel Prize 2016. And he said it way back. He wrote a poem, 1963, he sang, times they are changing, and they're still changing. Time is ever changing.
Right.
But you can remain the specialists in all medical care health workers. They can remain ahead of the curve if they act wise.
Right.
How do you become wise? You can acquire any amount of knowledge. Information about even these days, health information, is available to all stakeholders. Be you are a specialist, the same information is available to a common man who can, log on to internet.
Right. Right.
It's available. So what is the difference? Why do we need specialists then? Because acquiring knowledge or information doesn't make you a wise person. What makes you a wise person is experience. Wisdom comes from experience of success, experience of failure. And how do you gain experience? You gain experience by documentation.
Right.
By documentation. A document that nobody can challenge. Okay.
Right. Right.
I have told you all these because I lived all these.
So I'm sure, sir, the young clinicians and the young public health specialists, they will be motivated by this talk.
Yeah.
And they must have learned a lot from this talk.
Thank you very much.
Even we learned a lot from you, although being a very senior colleague in PGI during the interaction I told you. So we learned there, but also in this 1 hour, I think many virtues which you have told. So, sir, we have learned a lot from this talk, and the role of documentation and an evidence-based approach and the communication. It is really important for a public health specialist or a doctor.
Absolutely. You should convey. A primary health physician, for instance.
Right.
If he's seeing a patient, he has to document what he saw, what was the outcome. He has to track that patient for his life.
Right. Right.
Okay,
right.
Where did he fail? They have to accept that challenge.
Right.
Because these days, as you see, right from TV anchors to the panelists, to the common man on the street, everybody is trying to be a doctor.
Right, right, right.
So we don't have to be a doctor, we have to be a specialist, we have to be a super specialist.
Right.
We have to justify our existence.
Right.
You have to be a wise physician.
Right. Right.
Janta will not be a wise physician. They can't replace us.
Yeah.
Wisdom comes from documentation. Your own failures, your own successes, what worked, what didn't work.
Right. So
let people talk about it.
Yeah. So thank you, sir. Thank you for your very kind words, and during the talk which you talked about certain lessons. And I'm really sure that the young clinicians and the public health specialists will gain from this interactive talk. So thank you again for sparing your time and interacting with us in the Cypher Health Talk. So now it is time for Health Minutes from Doc Plexus.
Thank you, sir. Thank you.
Hello and welcome to Health Minute Highlights. While addressing a press conference, the director of the National Centre for Disease Control stated that the UK variant is currently dominating parts of North India. At the same time, the double mutant is found chiefly in Maharashtra, Karnataka, and Gujarat. Strict surveillance has been advised in all the states and union territories to report new variants of concern. The US FDA has approved dapagliflozin oral tablets to reduce the risk of kidney function decline, kidney failure, cardiovascular death, and hospitalization for heart failure in adult patients with chronic kidney disease. The fast-track breakthrough therapy and priority review designations were granted based on the efficacy data from a multi-center double-blind clinical study. Researchers have found that upon apical exposure, SARS-CoV-2 can survive up to 5 days in enteroids. It can further result in increased cytokines and a decrease in mRNA levels of angiotensin-converting enzyme 2, sodium hydrogen antiporter 3, and downregulated in adenoma. This can cause diarrhea by stimulating calcium-dependent anion secretion and inhibition of neutral sodium chloride absorption. According to a study published in the journal Stroke, young patients may get stroke after contracting SARS-CoV-2 irrespective of the severity of the infection. The researchers stated that the stroke could be due to blockage in large blood vessels and therefore recommend that all younger patients with strokes should undergo COVID-19 testing. What other measures can also be taken to avoid the associated consequences? Share your opinion by commenting below. Health Minute, the most liked segment of Docplexes, brings you the latest happenings in the medical field. Stay tuned for more insights. Happy Docplexing!